Thousands of those workers around the country have already received the COVID-19 jab. The country secured the single-dose Johnson & Johnson vaccine for use in the Sisonke program, which will be rolled out to thousands of healthcare workers. Professor Linda Gail Becker from the Sisonke program joins me now live. Professor, thank you very much for your time here on eNCA. I just want to start with the news about AfriForum and the Health Justice Initiative going to court, compelling the private sector to perhaps get their own COVID-19 vaccination. What's your response to that?
Well, I think there was a decision taken by National that they would oversee the national program. And of course, the private sector is very much part of our national healthcare force. So I'm not quite sure what the reasoning behind that is. But I do think on the Sisonke program, we are called together because we really want to provide these vaccinations to the whole healthcare force in South Africa, certainly those who are on the front line. And I think we're not differentiating between private or public. We have made an allocation of 1/3 to 2/3, just recognizing volume and numbers. And Sisonke is working with the NDOH and the provincial authorities to carry that out.
Looking at what's happened in the past week, what are you hearing in terms of how inoculation is going with healthcare workers, both in the private and public sector, especially looking at the fact that we seemingly don't have enough inoculation centers, and then there's a whole lot of nurses gathering in one place, which goes against the COVID-19 regulations?
Yeah, so we obviously want to avoid that if at all possible. It's still very important that we remember our NPI strategies. The vaccine itself kicks in its full force in 28 days. So we've got to give the vaccine time to kick in and work and do its magic. Just to say that we have been saying from day one that we are getting tranches of 80,000 doses every 2 weeks. The second tranche will be arriving on Saturday, and that we would have a gradual realization of coverage over the country. We're very committed to trying to get to every part of the country, but we're a small force. There are 31 sites in the Sisonke program. We are rapidly training others to come on board to help that workforce. And so we started in 18 sites, but the public and private sector will hear that those sites will be increased as of next week, and we will increase them week on week until we have used up all 500,000 doses that have been offered to the Sisonke program. I think you're right that after that we hope other opportunities for vaccines will kick in, and there'll be a seamless process to just continue vaccination from there on out.
Professor, can you just recap for us, for understanding of our viewers, what happens after 28 days? So those healthcare workers have to come back to get tested for COVID-19 to see if they, for instance, have developed the antibodies after getting the inoculation?
We're not doing that, Maseko, because we've got a very firm and impressive clinical trial that tells us that people develop their antibodies. They start from day 7. We see evidence, and they build and build. And as far as the trial has been going out, so beyond 100 days, we're seeing those antibodies still present. So we expect that to happen in the real world rollout, because that's what we saw in the individuals who participated in the clinical trial. And we know that this vaccine prevented severe disease and death by a figure of 85%. So we're confident, we're moving out. We're just saying to people, don't expect protection from day one. And so it's important that people continue to, conduct their opportunities to be in close quarters, close encounters, poor ventilation. We should still pay attention to our masks and being careful about fresh air, at least until we've got many more of these vaccinations out and we've given them some time to work.
All right, thank you very much for your time. That is, of course, Professor Linda Gale Becker of the Sisonke project.